You're listening to The Scoop on Ultrasound, where the world of ultrasound imaging comes alive through dynamic conversations. This episode is brought to you by EDM Medical Solutions.
Today, we're joined by Dr. Amy Patel, a leading voice in breast imaging and radiology advocacy. As chair of the American College of Radiology, Radiology Advocacy Network, and RADPAC, she's been instrumental in shaping policies that protect access to essential imaging. Dr. Patel's efforts have helped pass key legislation ensuring life-saving breast cancer screenings remain accessible. She's also the medical director of the Breast Care Center at Liberty Hospital and an associate professor at UMKC. Tune in as she shares her insights on the future of breast imaging and patient advocacy. Quality supplies make a difference. At EDM, our mission is to help you enhance patient care. For over 30 years, we have been a leading supplier of medical imaging products and accessories. It all started with one product, Crystal Ultrasound Gel. And now our catalog includes over 300 products designed to support your practice. From probe covers to needle guides, EDM Medical Solutions is the partner of choice for over 2,000 healthcare facilities in the U.S. Learn about our range of ultrasound solutions on our website by visiting us.edm-imaging.com.
Breast cancer is the most commonly diagnosed cancer in women worldwide, but advances in imaging are transforming early detection and diagnosis. With technologies like 3D mammography, contrast-enhanced imaging, and AI-driven analysis, we're not just detecting cancer earlier, we're improving accuracy, reducing unnecessary biopsies, and personalizing care like never before. In this episode, we're diving into the innovations that are shaping the future of breast imaging and the advocacy efforts ensuring every patient has access to these life-saving tools. Today, we have the privilege of speaking with a leader who is playing an active role in shaping the future of breast imaging and radiology advocacy, Dr. Amy Patel. Dr. Patel brings a wealth of clinical expertise to the table and is a strong voice in healthcare policy. She is the current chair of the American College of Radiology, Radiology Advocacy Network, and RADPAC, where she plays a critical role in advancing policies that support radiology and patient access to essential imaging services. Dr. Patel has been instrumental in advocating for fair and accessible breast cancer screening, particularly ensuring that annual mammography for average risk women starting at age 40 and earlier surveillance for high-risk patients is protected and covered. Her efforts in Missouri helped pass 3 key bills requiring private insurers to cover these life-saving tests without copays or deductibles, a milestone in patient-centered care. She is currently an associate professor of radiology at the University of Missouri, Kansas City, the medical director of the Breast Care Center at Liberty Hospital, and is chair of the Liberty Hospital Cancer Committee. In addition to these roles, she is a partner and breast radiologist at Alliance Radiology. Dr. Patel previously served as an instructor of radiology at Harvard Medical School. With her extensive clinical, academic, and advocacy experience, Dr. Patel is most definitely at the forefront of advancing breast imaging and ensuring that patients receive the highest standard of care. Dr. Patel, thank you for coming on the show.
Thank you for having me. I'm very excited to be here.
So let's start by looking at how breast imaging has evolved in recent years. There's been a shift from traditional 2D mammography to more advanced modalities like 3D mammography and contrast-enhanced mammography. And studies have shown that 3D mammography increases cancer detection rates by up to 40% and reduces false positives, which of course can translate to fewer unnecessary biopsies and less anxiety for patients. Dr. Patel, can you share your insights on how these advancements have improved early detection and diagnosis?
Sure. So the advent of digital breast tomosynthesis has truly been a game changer in the field of breast imaging. And for the reasons that you've cited, there have been multiple multiple articles now in the literature that discuss at their institutions finding an increase in cancer detection rate, reducing recall rates, which not only does that improve the patient experience in terms of them not having to come back for an unnecessary callback and mitigating patient anxiety? But the cost, I mean, we still have to look at the majority of states in this country, they still don't offer coverage for diagnostic breast imaging without copay or deductible. That's just the reality. So, cost comes into play as well. So, this has really been truly a game changer, and especially with cancer detection and just the accuracy that digital breast tomosynthesis has now uh, shown the field. When it comes to detecting cancers when they're millimetric, when they're less than 1 centimeter in size, leading to improved patient outcomes. We know if we can find a breast cancer that's less than a centimeter in size, the patient survival probability is almost 100%. So, it leads to less invasive treatment, less, obviously decreased mortality for patients, but also decreased morbidity for patients. They have better outcomes in terms of recovery. So, all of these things we have to think about, not just from a detection standpoint, an accuracy standpoint when it comes to digital breast tomosynthesis, but the whole spectrum of breast cancer care, their journey beyond the breast imaging center. We really are playing an instrumental role in that and improving quality of life for patients and saving more lives.
Right. I mean, it's amazing, really, what such technology is doing. But you point to something important that we'll get to later, which is access. Right now, from your perspective as a clinician, you're in the field, you're teaching, you're advocating, but you're still actively a practitioner, actively seeing patients. I love to hear how new technologies such as these change the way you and your team approach patient care, right? Could you tell us about how that's gone transforming and how you see it transforming in hospital settings and different settings, really how patient care teams are approaching?
Sure. So took over as medical director of our breast center in 2018. And just from 2018 to present, we've had so many changes when it comes to how we deliver care. And that's because the technologies have significantly transformed in a very short period of time. So I tell people, this is an exciting time to be a practicing breast radiologist because we truly have so many tools at our disposal and in our breast imaging armamentarium to serve patients. So, we've been really fortunate to have digital breast tomosynthesis over the years, which has been our gold standard for our practice. But also, ensuring that we have very cutting edge breast ultrasound technology. Just the quality of the ultrasound imaging has improved significantly over the years and with the current units that we utilize. We've been able to employ new tools such as abbreviated breast MRI in our practice, particularly with the ultrafast sequence component, which has been wonderful for patients who have dense breast tissue. We've also been able to employ another tool, artificial intelligence breast ultrasound. And we employed that back in 2019. So we've been using it for a number of years. And that's just really been improving the accuracy for patients. And I haven't published any of our data yet regarding our AI breast ultrasound. But what we are seeing is we've been able to maintain our cancer detection rate, but reduce our false positives or our unnecessary biopsies
Right.
by almost 40%. So that's been a huge game changer for patients to be that clinical decision support, sort of like a second opinion consult. We as a radiologist, of course, are the ones that are driving the care for the patients, making the ultimate decisions. But having all of these new cutting edge tools in our breast imaging armamentarium has truly been a game changer for our patients. And we've been able to detect more cancers and as a result, save more lives.
Absolutely. I mean, that drop that you just mentioned of 40% is true, is remarkable, incredible, and I'm sure that has an impact on patient care. You mentioned something that we've talked about on the podcast a lot, since this is an ultrasound podcast, is AI and ultrasound. So I just love if you could expand a little bit on that, in what exactly, in the way in which you're using it, how it's empowered the ultrasound users, and what other benefits you see as it relates to ultrasound and AI.
Sure. So we partnered with a vendor called Kios back in 2019 to implement AI breast ultrasound. So just partnering with a vendor, there's a lot of institutions that are coming up with homegrown AI algorithms, which is wonderful. We unfortunately were not, in a position to do that. So it's been really great to partner with a vendor, which there's so many vendors out there now for AI solutions that are really great teammates with us in the way that we deliver care. So we were able to implement this in 2019, which was a very easy collaborative transition process with our team, with our PACS IT team, with the vendor as well. And essentially, how it works is it's a machine learning algorithm that's based on over millions of cases where there's radiologic and pathologic correlation. And essentially, the AI algorithm, it analyzes over 17,000 features of interest of a lesion, which is, so mind blowing, if you think about it. But that is just how precise the AI tool is. So essentially, you bring up a mass, for example, that maybe you aren't really sure. You're thinking, probably this is benign. I'm not really sure. Do I really want to put this patient through a biopsy? And so you can analyze the mass, basically analyzing it in two planes, whether it's, you practice transverse sagittal at your institution or radial anteradial, and you analyze the lesion by creating. It used to be you'd create a box around the lesion, but now you can literally just click on the mass in two planes and then click a button called analyze. So it's pretty quick, pretty nifty, and then it renders a BI-RADS assessment. And that's really great. So because we do, report via BI-RADS. And so from there, you see what the BI-RADS assessment is. And then it'll say whether the AI algorithm thinks his mass is benign, probably benign, suspicious enough to biopsy, or probably a cancer, and so on and so forth. And so that's been really amazing for us in clinical practice to have that as sort of a second opinion consult in that capacity.
Right, and do you think that there's also savings in time as well? I'm sure by being able to use the AI. Have you witnessed that in practice just yet? Has it allowed you all perhaps to take on more cases or to just reduce time spent in the workflow?
Yes. So initially, with any technology that you implement, obviously there's going to be a learning curve. It is going to slow you down a bit, slow down your workflows. There can be elements of frustration. I will say that with our AI breast ultrasound, the transition and implementation was fairly smooth. Now, yes, it did slow us down in the beginning as we were learning how to use the algorithm more efficiently, making sure that our workflows with our technologists, with our team, was more efficient, making sure that, our findings were properly populating in our reports because there is a feature with this AI breast ultrasound tool where you can embed the result in your dictation. So all of these things obviously take a little time. But once we had that figured out, which did not take very long, just a matter of just a few weeks, we were really off and running. So it really has saved us time. And I've talked about this on some different, interviews and podcasts that on average, we're able to get in around 2 to 3 extra diagnostics just because using this tool really helps speed up our efficiency. Now, we don't use the tool on every lesion, and it's recommended that, particularly with AI breast ultrasound, you're not necessarily using it on every single lesion because there are some lesions where it's a cancer, 100%, no question based on the features. No, it's a simple cyst based on the features. But what about those cases where you're just not sure? Could this be benign? Could this be probably benign? Uh, or is this something that warrants enough suspicion that we should go ahead and biopsy? So it's kind of like the 2, 3, 4A areas I like to say is where I feel like AI ultrasound really demonstrates its clinical utility. But on the whole, we're able to save, a good amount of time, and we have seen that at other institutions who have now been using AI breast ultrasound for a number of years.
That makes sense that in the beginning, adopting any new tool, any new technology, especially something as radical as AI, right, is going to slow you down a bit. But I think it's great to hear that if you push forward, you modify your processes, your workflows just a bit, everyone's kind of on board, getting used to this, it can produce great results. I mean, that's what we keep seeing right across the healthcare space and specifically within radiology is that AI can play a key role. It's just the way that one implements it and uses it as well is going to determine how successful the effort is, right?
Yes, and just being patient about it and also keeping an open mind. I've had colleagues in the field reach out saying like, "Well, I've been practicing breast imaging for decades, do I really is this really going to improve the way that I take care of patients? I already have a high cancer detection rate, so on and so forth." But, as we're seeing in the literature with not just AI breast ultrasound, but other AI modalities, other AI algorithms, we're seeing that these algorithms are finding cancers that we aren't finding. And so I really feel, and I'm sure we'll get into this, but I really feel that AI is going to help us do what we do even better because the literature is demonstrating that, and studies are now demonstrating that.
If you are high level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStel Olds can high level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStel Olds. Visit us.edm-imaging.com/tristel. That's TRISTEL. And now, back to the show. Exactly. And that leads perfectly into the next question, which is what you think are the most promising advancements in breast imaging that could reshape the field in the next few years. I know that that can be a loaded question because there's many things going on. So I'll just give you a space to tell us what you feel are really the most promising advancements, whether it's AI or some other aspects.
Yes. Well, I think that as we are discussing, I truly feel that AI is going to be shaping the future of breast imaging. It already has begun to shape the future of breast imaging. We're able to see these algorithms that are now being devised for AI mammography showing just incredible cancer detection and accuracy. For example, there is an AI solution that particularly was employed in a institution in Hungary where they looked at over 25,000 cases. And the cancer detection rate, essentially 13% more cancers were found than the radiologists who look at the imaging. Now, there's some obviously differences to how we practice in the United States where they have a double reader, situation there where we typically have a single reader. A lot of times in a lot of these countries in Europe, they're doing mammography, performing the exams every other year, whereas in the United States, we recommend every year. But the bottom line is the results are showing a lot of promise and 13% more cancers. I mean, that is something that is undeniable. So it'll be really interesting to see as AI mammography is being more utilized in this country, what we see in terms of cancer detection. So the AI mammography, AI breast ultrasound, with MRI, all the modalities, looking at MRI and seeing uh, particularly with the chances of metastatic breast cancer. What are your chances of developing metastatic breast cancer? And what are your chances that lymph nodes in your axilla are positive and there's positive lymphadenopathy? AI can hopefully in the future predict that. uh, what are your chances of a recurrence of an invasive ductal carcinoma from a patient who's been diagnosed with ductal carcinoma in situ? I mean, these are all the things that is really exciting about the future. And when you think about things such as radiomics in the field of breast imaging and genetics, and what can an AI tool do to look at all of the features of a mass, looking at its texture, looking at the margins, looking at all the features so that we can pinpoint areas where we can produce biomarkers to show, how responsive is a cancer going to be to a certain therapy? How precise can we be in targeting these biomarkers to making sure that we're eradicating the cancer for the patient? So there's so many implications for AI and breast imaging and breast cancer care. It's truly an exciting time, and I do feel that it's truly going to be the future of how we deliver breast cancer care in this era of what we call personalized breast cancer care.
Absolutely. I mean, the way that you describe such advancements really links perfectly with precision medicine, right? And the idea of personalizing care more and more, specifically on what you're saying for breast cancer detection and in the field of radiology, I think it can be a game changer. Now, when we look at the timeline of such advancements like those which you were just discussing, do you feel like we are closer, that in the next few years we'll see more and more? Or do you sense that there is still perhaps not a strong enough consensus among radiologists in the US, perhaps those colleagues which you have even abroad in Europe, but specifically in the US, do you think that there is still some clinical apprehension to adopting such technologies and implementing them into practice?
Sure, that's a great question. There has been so much excitement behind AI, but we know that the adoption has been a very, very slow process, particularly in the United States, and justifiably so. I mean, we need to make sure that these algorithms, are reproducible across all practice types, are devoid of bias, account for drift. I mean, there are so many things that we need to be able to ensure safety for patients, just the regulatory aspects from a government side. And I know that the government has been, very methodical, very slow approach to making sure that the use of AI is ethical and safe and standardized for all patients. But with that said, it'll be interesting to see in the years to come, particularly with the current administration about AI. They seem to be a little bit more aggressive about the AI push. And when the first Trump administration took effect, there were a lot of AI algorithms that were being, FDA cleared and FDA approved. And then there was a little bit of a scale back in the Biden administration. So it'll be interesting to see now in a second Trump administration where we fall with AI. But truly, even you can have the best algorithm, but there's a lot of practices that are hesitant to take it on because of the reasons I mentioned, but also most of these algorithms are not being reimbursed. So if there is a path for reimbursement in this country, if we do start to see widespread adoption of insurance coverage for these AI algorithms, I really do feel that it's going to take off even more. So and we are already seeing some reimbursement happening, particularly with AI breast ultrasound on the East Coast. But how will that translate to the rest of the country? So it'll be really interesting to see. So I think a lot of these, issues come hand in hand. The technology of it, the ethical, the safe use of AI, the regulatory aspects. But if we do start to see increased reimbursement of AI, I do think we're going to start seeing it taking off even more in practices and institutions.
That makes sense. I mean, I think from what you're describing, the audience can quickly capture that there are several actors involved in adoption, right? You have, of course, physicians, the clinicians themselves, but then you also have government playing a key role in policy. Then you have the insurers, right, who are absolutely going to play a key role because there is a financial aspect to all of this. And then we also have healthcare facilities themselves, right? So the administration, and I just want to touch on that a little bit on what you see in the field from the perspective of administration of healthcare systems, hospitals. Do you sense that still we're also late there, late to the game? Or do you feel like there's a sort of hesitation to adoption due to cost, specifically tied to perhaps the way that insurers are viewing it? Have you seen that dynamic play out?
Absolutely. So I think that, there's still a lot of, I would say, lack of education and even uncertainty about AI, particularly at certain institutions and practices at the C-suite level. So I think that a large part of it too is just the ethical aspects of AI and the safety, so the legal implications. I think that any, health system is very cognizant, especially in this day and age, that healthcare can be a very litigious, complex process. And so, making sure that these AI algorithms are being deployed in a safe, ethical, and legal manner, I think that's a top of mind. But reimbursement is definitely a huge thing because it does cost to obviously implement these tools, and time is money. And with our institution, we have breast ultrasound for AI, but we don't charge anything for it. So we felt that it was unethical to charge a cash pay for this. However, there are some institutions who are offering AI, whether it's mammography, ultrasound, etc., that are offering uh, the tool, but for a cash pay. So it's just, I think, really institutionally dependent. However, I do think that if the AI algorithm is FDA approved, not just cleared, approved, and there is reimbursement behind it, I really do feel that there are going to be more institutions that will be backing these algorithms.
Of course, of course. Now, we have to recognize that technology alone isn't enough in terms of improving breast cancer detection rates and patient outcomes. We have to talk about the role of advocacy in breast health. And it's so important for women, for patients to understand the how critical regular screenings are and just their options, right? So there's a patient education aspect that I'd like to turn our attention to now. As someone who is deeply involved in advocacy and policy change, what role would you say that you see imaging professionals playing in advocating for patient education and access? How can they do more in their current role?
So, as breast radiologists or any of us who are delivering breast cancer care, whether we're a breast surgical oncologist or a breast oncologist, we are obviously, very busy. Volumes are continuing to rise. And sometimes we think, gosh, do we have any extra hours in our clinical day to do anything else? But, I am in the line of thought that I think it's imperative that we who deliver breast cancer care are educating patients. And it really is truly a grassroots approach. Um, from going out into the community and speaking at events and talking about the importance of breast cancer breast health, and not just in the month of October, but all year round. Whether you're going to, a community event that's being held at a community health center, whether you're speaking, you get a few moments speaking at a church on Sunday, any avenue that you can potentially have to go and to educate patients. I really feel that if you, as a physician who's delivering breast cancer care, feels comfortable in doing so, you need to be out there in the community and educating. Like people know me, there's nowhere I won't go. I will travel hours to rural parts of Northwest Missouri to talk to patients about the importance of breast cancer screening, frequency, getting risk assessed by age 25. What does that mean if you're above average risk? What does it mean if you have dense breast? These things are important and they matter. And especially, things like breast density. And now with the new MQSA FDA mandate on notifying patients about their breast density, patients are still mystified by things like this. Like, what does that mean that I have dense breast? And providers, primary care providers, OB-GYNs, some of them I have found need education on it and are wanting the education on it. So it's not just about us going out in the community trying to find all avenues to educate patients, but we really need to be working together with our referrers, with our primary care, with OB-GYN, talking to them about the changes. What does this mean? Which modalities are superlative for women with dense breasts? How can these patients have access to that as well from a monetary insurance standpoint? All of these things truly matter. So we as particularly breast radiologists, we can play a very critical role in all of this and play just a very crucial role in the spectrum of breast cancer care and delivery.
Exactly. With technology advancing so quickly and just how quickly medicine changes, I think it's probably easier than we like to think for clinicians who are not radiologists themselves, like you said, the PCPs or the OBGYNs who are out in the field, they may not all the time be updated as regularly on what's going on. And so it is so important for there to be greater advocacy and even on the part of the clinicians to be seeking that sort of education to stay up to date and to be able to deliver better patient care. I think that such knowledge for patients is empowering. Like you were saying, so often there's so many questions, even when patients find out, okay, I'm at a higher risk. What do I do? And clinicians do play such an important role in that. As we wrap up, I think we'd like to look ahead again. I think the audience would benefit from hearing more of your insights on what the future is holding. But specifically, I'd love to hear more of how you see the role of breast imaging evolving over the next decade. Do you think there are changes coming to the nature of the role? And do you think that clinicians, perhaps those who've been practicing for a while, need to start saying, okay, I have to see how our role may be changing, may transform over the next 10 years?
Sure. So we've, touched upon this at certain points today, but again, I truly feel that practices and institutions, radiologists who might be hesitant on the utilization of I think that we're really going to have an open mind and embrace it. It's just AI is just going to help us be better at what we do for our patients. We have to face realities. Our imaging volumes are exponentially increasing. We have an immense workforce shortage in our field. We have a lot of retirements. We need to increase the number of residency positions for radiology, which we are working on at the federal level to do that. But it's still not enough. And it's not going to be enough for a while. And so, what else can we do to help this complicated and complex way that we're delivering healthcare and the challenges we face? So, I truly feel that AI will play a huge role. And also, touching upon backtracking a bit on advocacy, what can we do as breast radiologists to push for federal legislation? And that I think is also going to shape the future. We advocated for years for breast density notification through FDA MQSA, and finally, years later, we are seeing that come to fruition as of September of last year. But what can we do at the federal level to ensure widespread insurance coverage for patients, for the modalities they need, for patients who are high risk, for patients who need supplemental screening? That's why we've been pushing for pieces of legislation such as the Find It Early Act and the Access to Breast Cancer Diagnosis Act, which are two pieces of legislation that will now need to be reintroduced this legislative session. We don't see any reason why they won't be. But these pieces, if one of them can pass, which are similar policies in terms of widespread coverage for patients who are needing access to diagnostic breast imaging, to supplemental screening if they're above average risk, pieces that are being passed throughout the country in certain states. If we can get that kind of legislation passed at the federal level, so no patients left behind, I think that will be a huge game changer. I think that that will encourage other practices and institutions to implement newer technologies that maybe they didn't prioritize before because frankly they didn't have the funding to do it. But if you've got an avenue where you now are having reimbursement for these modalities, then I think that institutions are going to take a second look at this and say, okay, now we can actually afford to provide that access for these patients. So I think, the future is exciting. Of course, like with anything when it comes to the future of healthcare, there's going to be challenges. But I think if we just continue to keep, our foot on the pedal, come together as a breast imaging community, a breast cancer community, and advocate for these key issues, I think that the future will be bright for our patients and in the delivery of that personalized precision breast cancer care.
Yes. Thank you so much for sharing all of your insights and for the work that you do. I think that you explained very well just how critical advocacy is and really how much power is in the hands of a radiologist, the clinic, the patient care team. And it is incredible, truly, the impact that individuals coming together, right, as a community of physicians can have to push policy change and therefore also affect patient care in a very positive way. We need more of that. So thank you, Dr. Patel, once again for coming on the show.
Thank you so much.
Thank you for listening to this episode of The Scoop on Ultrasound. Subscribe today to be notified when new episodes are released, and visit our website, us.edm-imaging.com, to learn more about who we are and what we do.